The finalists are Laura Kerr.
I work for the Norfolk Healthy Child Programme, which is an NHS delivered service, and as health visitors we work to improve the lifelong outcomes of children and young people. We do lots of home visits, we work in with stakeholders, so we work in GP practices, we work in children's centres, sometimes I go into schools, so the work's really diverse and really varied. I love health visiting because it's an opportunity to start right at the beginning, and I think the impact of early intervention is so significant and the outcomes for children changes so much if you start right at the beginning, and I think that was one of the things that really motivated me to be part of it.
Miss Amy Berger.
The short story is that I trained in the Queen Elizabeth as a trainee. One of my trainers, who was a now retired breast surgeon, was aware that I was interested in breast surgery and kind of kept an eye on me, and then he retired and I applied for the job and I was very lucky and I was appointed. Breast cancer nowadays is actually one of the cancers which we can deal with really successfully and women actually can do really well. You have to be sympathetic and take things at the speed that you feel is right for that individual patient. It is emotionally challenging and draining, but we do try to be really positive, move forward, get a plan, and at the end of the day, hopefully get the patient treated and on with their lives.
Stephen Eadie.
I was on my way back down on the lift from doing a previous job with a patient from A&E. Heard a lot of screaming and shouting going on, and I thought we had a security issue. I was expecting to separate people when I got down the lift, but as I stepped out of the lift, it was evident then there was a lady going into labour. The husband's running around like a chicken with no head on because he was panicking. So I had a high-vis jacket on because of what the job I'd been doing. So I just took that off, and the baby was there, and Hans was holding the baby until the rest of the team arrived. What can you do? It's either deal with the situation or flee.
It's an honour and a privilege, but it's also a bit surreal because it's something that I do every single day. That's the win in itself, to be honest.
You know, I'm just a little cog in the big machine, so it's not just me. So if I won, it wouldn't be me, it would be my team. I'm quite humble, really, and I think I always feel that I'm not my own worst critic, and I always feel that I could do better.